Kathy and Jamie again. Good morning.
Good morning, Mr. Chair and Commissioners. I just handed out the information for this week, our weekly report. The most notable, as you can see, the active cases are coming down a bit. Last week when we were here, we had 257, and this week 190. So we're slowly getting back in the right direction. A few more hospitalizations. I talked with the epidemiologists about Minnesota hospitals, and they're still seeing a number of hospitalizations. They haven't declined very much. And so, but, you know, they're manageable. And then I talked with, on the North Dakota side, they're about the same. So it's not been a huge increase in hospitalizations. Our 14-day case rate is 64.01. Now that was an increase from last week, but as you see, this is a delayed number. So it only goes through April 10th. So we suspect that this number obviously will go down with the cases as the active cases are real time, and the 14-day case rate is a bit delayed. So. And then on the next page, we have our active cases by age, and you can see there's quite a large percentage. We've always have seen the 20 to 24 throughout particularly this last month, but we also see now active cases in 10-year-olds and all the way up through the 40 to 49 has a number, but you see a lot of it in the youth. So 10 to 14 is up there, and the 25 to 29 and the 30 to 34. So we've got a variety of active cases throughout those ages. Now again, the vaccine that is on the market for us is only 16 and older, and that's just the one vaccine. So, anyone younger than 16 obviously is not eligible to get a vaccine. And then the cumulative cases are the 20 to 24 per age range, so that's still the highest one cumulatively. I talked about the hospitalization, so we did see an uptick in Minnesota, and then and hopefully we're going to be seeing a decline. The deaths in Clay County are still at 90 cumulatively. So the hospitalizations and ICU hospitalizations, it's the 29,477 for hospitalizations and the 6,006 for ICU. And then I added, I think Commissioner Mojo, you asked about the COVID cases per zip code. So I added a separate sheet. We had to pull that data off, but anyway, this is the cumulative cases per zip code, so I have all of the cities and zip codes, and then the number of cumulative cases. We can't get active cases per zip code. I've checked with the epidemiologist at MDH, and this is the best we can do with the cumulative cases, so hopefully.
I just want to say thank you. This really helps to get a whole picture view of what we were seeing and are seeing whole county-wide, so thank you for doing that.
Sure. And then I also included, last week we didn't have the information on our saliva test site. The individual that provides the information was out, so we have it today. So this is, you can see we started in January. Well, we have numbers before that, but just what we've been sharing, and then through April 18th. So that week of April 18th, there's still over 1,000 tests being done, 707 in Minnesota residents and 303 in the non-Minnesota or mostly North Dakota residents. So with a 4.11 positivity rate for that week. So that also has declined since the last couple of weeks. So there's kind of the snapshot of the saliva testing site, and it is still functioning and operational, so still no word on when they may not provide that testing site, but so far we're still continuing that. And then I'll pass it over to Jamie.
Before you go to Jamie, the chart For Clay County active cases by age, you have the date of April 27th. Is that fairly consistent with that date and time? Or is that just the date of the report?
Yeah, for the active cases by age range, yes. Yeah, it's fairly consistent with that real time.
So we clearly have some cases going on in our school systems.
We do. And we're really working with the schools to at least get the 16 and older vaccinated, but,
Okay.
you know, anyone under 16. So they're still doing the quarantine for when they have cases. I know that they quarantined one classroom, I just heard yesterday, in one of the schools, so there's still cases going on.
Yeah, I think Commissioner Mosher was aware of that.
Okay.
Are we helping them with contact tracing in that case, or do they do their own within their school system, or?
They actually do that internally, but they're also working with the case investigators. So all of the cases are reported to our staff
Okay.
on a daily basis as they come up, but they're working pretty independently now. Initially, they were working closer, but they're reporting what they have to our staff, our case investigators.
Thank you. That's-
So we did bring some new information that we were able to receive on the data. We've talked a little bit about breaking it down in terms of vaccine and age groups. And so we did, this next handout is a breakdown of the Clay County cases, but what we have added here is the people with at least one dose in the age group. So we've got 16 and 17-year-olds, 222. I'm struggling to look at this myself, so I hope you can see it. And we've got the 18 to 49, a little over 8,000. And
Bring
50
my
to...
magnifying.
Yeah, right? I'm going, let's see if I can move it a little farther. And then we have the 50 to 64s, which we've had, that 4,000. And then the 65 plus at a little over 6,000, and those that we don't have an age. So our total of 19,137, I think that is, with the first dose. Basically, this is kind of breaking it down by age group. We talked about our MIC system, that it's not necessarily all of the doses that are going into MIC from North Dakota. And we keep asking the question and keep getting a consistent answer that there is a lag in that information coming to Minnesota. So the most important message in this is that we consistently see our numbers low, but we feel very strongly that they're higher than what's represented, which is coming through Minnesota and out of the mix system. So
That 19,157 are ones that received their shot in Minnesota.
and that's just the first dose. So if it was in North Dakota and it did get into the mix system, it's counted. If it didn't, it's not. We talked about the VA and the pharmacies on the North Dakota side that is not coming over consistently. So let's see. So, and then just basically the comparison to the statewide. So what we did with this data compared to what we've been looking at is that breakdown by age. Do you have any questions about that?
No, it's a good report, though. I like it.
Okay. And then another map that we added is a breakdown of doses by zip code. So this is, we had a breakdown of cumulative cases by zip code. This is a breakdown of doses by zip code. Just to kind of take a look of where the percentage, so total doses plus the percentage by zip code in Clay County. And the highest number of doses have been in Moorhead, but, it's really pretty consistently high throughout our whole county. So I think this is a good map to really show that we are seeing vaccine across the county.
Well, I think we should maybe point out the fact that the zip code 56536 has 52% of its population vaccinated. And it looks across the board that Commissioner Gross's district has the highest vaccination percentage.
Wow. I guess he
Yeah,
gets
work.
accolades for that.
Yeah, I'm out there trying to get them.
Spreading the good word.
Is that your door-to-door campaign?
then the last page, we have the total of doses administered by Clay County Public Health alone, 13,359. And I just looked at the state map last night, and we're pretty high in the state for public health agencies and the doses we have administered. Plus, we have reached 100% consistently for that 3-day, the 72-hour turnaround. So we're pretty proud of that. We're also pleased to hear that the 72-hour has been suspended, so that's no
Great.
longer. So we're looking at,
Oh,
Finally.
yeah,
yeah.
yeah, so we're at 7 days now, so. So looking at the doses that we administered, we'd actually planned on a low number of doses last week. We'd planned for 626 odd number because of Pfizer. We did have an evening clinic last week to support students in the schools, 16, 17, 18-year-olds and their parents. And we probably, of 126 doses, we did a little over 80. So we were disappointed, but at the same time, we had been pushing out to parents that there's an opportunity. We didn't have Pfizer available to us, but we were pushing out the opportunities on the North Dakota side through the Sanford and Essentia clinics. And so what we're hearing is that they're accessing it and they're getting vaccinated. But we still, we finally got our hands on some, and we had a clinic last week. So of that 626 total doses we'd planned for last week, we actually administered just 373. So that was a disappointing week, but not surprising at all. Based on what we've been seeing in terms of the response for vaccine, we asked for less, knowing that it would be less. So,
But you're able to store the unused vaccine.
right, with the 72-hour lift there. And so this week, we will be doing 300 second doses, at least that's our plan for second doses. And then 342 first doses are planned this week. And so basically, our numbers are down. We do get a pretty good response now for our second doses because we're pushing that out, the registration a week in advance. So that's really made a big difference too, so that people can get signed up for their second doses. Plus, our staff are spending a lot of time calling people. If this day doesn't work, can we reschedule you for another day? So a lot of staff time and energy is going into getting people back in for their second doses. And then the last thing on this page, you had asked for some North Dakota, Cass County and North Dakota vaccine administration data as of 4/25. So Cass County residents with 1 dose, 55% of the population, and those fully vaccinated, 47.8%, and then compared to North Dakota residents, 46.8% of the population and 40.2% of the population statewide are fully vaccinated. And so, yeah, that's,
So, Jamie, the other locations within Clay County where our residents can get the vaccine, whether it's through Sanford, Essentia, or the
pharmacies as well.
pharmacies, are we hearing, do they all have adequate supplies?
Yes. And so there also is a weekly meeting that we have, a regional healthcare coalition region, where they're talking about who needs vaccine basically across our region as well. So we're pretty saturated when it comes to vaccine right now, so there should be no reason a person could not get a vaccine if they're looking for one. One more thing I wanted to talk about too is that we talked about the testing the cases in younger students and sports-related activities, and Minnesota Department of Health, although they're trying to keep students in school and keeping them active with activities, are also stressing the importance of testing. And so they are effective yesterday. Minnesota is offering organized sports teams additional testing support and options in order to provide testing for them. And so they can actually, they can go to a saliva testing site, they can order a home kit, but they also can order mass testing for their teams, and then also through their school district, they could access testing. So really just encouraging as they move forward with activities that they comply with the guidance for activities in school, but also encouraging them to be testing if they're participating in these activities. And then just one final thing, the pause on the Johnson & Johnson, you probably heard that is, has lifted, and so Johnson & Johnson will be available again in the communities.
And one more comment, Mr. Chair and Commissioners. We have been working with higher ed because they have so many students that'll be done soon, scattering all over. We did not receive the doses as we requested a number of weeks ago for that to provide to all of those higher ed students. However, I did secure mobile vaccination from Essentia Health. And so they're going to provide some vaccinations. I believe only one of the higher ed facilities are going to take advantage of that, and that'll be next week. So they'll be providing, but they offered it to all of them. So they'll be, the students are kind of at the end of their semester, and so they're into finals soon, and final days of classes. So some of that reluctance now was just because there's so much going on for them. But at least one of the higher eds will take advantage of the mobile unit that's going to bring vaccine right to their campus.
So Kathy, are you, your hours then that you're doing the vaccines at the MCOMs, is that going to change or?
We'll, like Jamie mentioned, we did an evening clinic for those, students that could get away. So we kind of tailor that each week to determine who, we want to make it accessible to everyone. So if late afternoon and evening hours are better for people, we'll tailor that to those folks. We've always expanded it. We've started, we have also had students that, student nurses have been helping vaccinate. So we've been also wanting to ensure that we can have the students there, and that's usually during the 9 to 1 or 9 to 2 hours. So we wanted to make both available to them because we have a number of additional vaccinators, but it's also a good experience for them. It's a practical experience that they can participate in, so it's kind of a win-win. So we've been also tailoring the hours to them, but after next week, I believe we won't have the student nurses available anymore. So again, we tailor it. Usually it's during the day, but also we'll provide evening hours.
Okay. Any further questions for Kathy or Jamie? Thank you for your report.
Thank you.